I'm just a bill, yes, I'm only a bill, and I'm sitting here on Capitol Hill. Well, it's a long, long journey to the capital city. It's a long, long wait while I'm sitting in committee, but I know I'll be along. Yeah, yeah, I hope and pray that I'll.
And good morning, this is Bill Scher on the LiberalOasis radio show. Later in the broadcast, we'll be talking to Marissa Trevino, blogger from Latina Lista, on how the Republican Party is coping with their inability to attract voters other than Caucasians to their fold. They try so hard. They really do. She has lots to say. It'll be great to talk to her. But first, you got to let your kids know that when we don't torture in this country, kids should know that. Kids should know they live in a country where we don't torture. We do harsh interrogations. It's a big difference. Big difference. Just because there is pain inflicted during the questioning doesn't mean that it's torture. It's just harsh. I recall when George W. Bush was running for president, and all conservatives were in a lather that we had a immoral figure in the White House. Think of the children. All this dalliance is going on in the Oval Office. He's setting a horrible moral example for the kids. All these kids are going to grow up without knowing right from wrong. That's why George Bush, you would always say, I'm going to return honor and dignity in the White House. And put my hand on the Bible. Restore honor and dignity. Didn't mention the whole, I don't call it torture, I call it harsh interrogations thing. Didn't come up in 2000. But I'm suspecting that the kids are not already looking up to George Bush as their moral leader these days. That's because this week, after a strong bipartisan majority, both houses of Congress said, we don't want children in our country to go without health insurance. We think they should have access to doctors. We think they should not have to go to the emergency room when they're grievously ill and about to die just to get some health care. They should be able to have the financial ability to see a doctor when they need to preventively and have a healthy population. Seems to make sense. Not to the decider. This is what he had to say about his veto of expanding the state children's health insurance program this week.
I want to share with you why I vetoed the bill this morning.
Oh, please do.
Poor kids first. Secondly, I believe in private medicine, not the federal government running the healthcare system.
He loves those poor kids so much. Maybe that's why poverty has gone up over the last 6 years. And I also love the fact that he doesn't want to be Washington run. He doesn't think the federal government should be in charge. Now, I could talk about this in a few different ways. I can just give you the basic facts. This is the state children's health insurance program. This was designed by Republicans in 1997. It's been in place for 10 years. The states take the lead in administering the program. As conservatives always said, let's devolve power to the states. States' rights, that's be so great. And also on top of that, it's for the most part the insurance that's delivered is from the private sector. It's government financed, but the private sector is delivering it. So I can give you all those defensive arguments why he's lying to you, and they'd be true. But let's take into account that the private market would not magically do this on their own. The government is involved here. Our government is involved at our request. We spoke to them and said, we do not want our children going without insurance. We are willing to put up the money to pay for that. It has happened for the last 10 years, and it has worked. This is a government program that has unequivocally worked. You actually cannot find anyone, liberal, moderate, conservative, Republican, Democrat, nobody is saying this program is a failure because it is patently obvious it is not. Uninsured rates for kids have gone down while uninsured rates for adults have gone up. Just clear as day. But there are still 9 million more kids who don't have insurance. You have made progress on a problem, but there's more work to do. What is the logical thing to do in that situation? Build on what you know works. This government program works. That's why you had 67 senators in both parties. You had 45 Republicans joining Democrats in the House. Why you have almost every governor in the country, Republican and Democrat. And most of these guys and women know they have to run for re-election next year, and George Bush does not. So they're screaming at Bush, "Don't make me take this vote. Don't make it to sustain your veto. I got to face the voters next year." And believe me, the kids are going to hear it. Kids are already speaking up. But George Bush never wanted to care about how unpopular he is, and it shows, is making an ideological case because it doesn't matter what works and what doesn't work, doesn't matter what we already know is happening on the ground. He just doesn't want government involved, period. Actually, that's giving him way too much credit. He is happy to have an SCHIP program, that's the acronym SCHIP. He's happy to have that program remain, just wants to underfund it so it can't cover all these kids. In fact, he passed regulations arbitrarily in August. Okay, this is a state-led program. The states have flexibility to determine how to administer it and who is eligible for it. Every state's got different criteria, different cost of living, different health insurance costs. It makes sense to do it that way. What George Bush did, despite his claims he doesn't want Washington involved, he, leading Washington, imposed arbitrary restrictions on the states, forcing them so they can't expand coverage to the uninsured in their states. Arbitrarily federal regulations that make no sense at all to the governors. And they may even be illegal restrictions because he didn't go through any proper process to issue them. He just sent a letter. I hereby decree. And that's not how it works in a democracy, as it turns out. So he is hypocritical 8 ways to Sunday on this. And so it's not really a question of government versus no government. This is a question of good government versus bad government versus responsible government versus irresponsible government. And the public, regardless of ideological stripe, is more than happy to have responsible government that spends their tax dollars effectively to cover kids and make sure the population is healthy. You have conservatives like George Bush who are saying, I'm happy to spend your money in the worst way possible, underfund the program, spend money. I mean, the cost of the war, I mean, it's not necessarily an apples-to-apples comparison, but we're talking half a trillion. We're going upwards of $500 billion. They have a request on the table for this year just for another $200 billion. $200 billion this year. The amount they would spend additional on children's health insurance this year in this bill is $7 billion. $35 billion over 5 years. You may have heard that $35 billion number going around, but it's $7 billion a year versus an extra $200 billion a year for a war that, by the way, isn't working. Not effectively stabilizing the region, not effectively securing any oil supply, as Alan Greenspan would like. Just making a big, stinking mess. That is conservative government for you. When we come back, how are they going to take that great conservative record of accomplishment and win over the Latino vote? We'll ask Marissa Trevino, the great blogger at Latina Lista, what she thinks they are doing, what they could be doing, what they aren't doing. This is Bill Scher on the Liberal Oasis radio show.